This is my eldest baby doll Southdown sheep. His name is Mo. And recently he had an abscess. Normally I would take care of an abscess just here at home. But because this abscess was very characteristic of a common sheep and goat disease called caseous lymphadenitis, or CL, I wanted to bring him in to have it tested. I had to wait about 8 days for the culture results to come back, and I was very pleased that it came back negative. However, it is good practice to test when you have an abscess that looks like this disease. Now, this disease will present with abscesses that are near the lymph nodes, and they will be quite large. You can also get other abscesses on sheep that are smaller and most likely not CL. Now, I'm not a veterinarian, but I would like to take you along to show you the medical interventions that we did with this sheep. I want to point out the location of where the abscess is. So it's just posterior to the mandible, where his skin is shaved. And this is why it was alarming to me, and I wanted to test for CL because it's more where a lymph node would be. Usually a dental abscess is going to be a little bit more anterior and closer to a tooth root, and it would be smaller. So his original size was about the size of a tennis ball, which is quite large. So this breed of sheep is a Shetland, and you can see that they have a nice clean open face with no wool on the face. So for a sheep like this, it's going to be a lot easier to identify when they have an abscess sooner. So unfortunately with Mo, I didn't identify his abscess until later on because he has such a woolly face. And so I didn't see it hiding underneath all that wool. But these guys with the open face, you're going to see it a lot faster. I'm not aware of any wounds that would have caused this abscess for Mo, but I will say that when we were shearing him this spring, my Oster Showmaster bit the dust right in the middle of shearing him. So I had to go buy a brand new Oster and finish shearing him. I'll insert a picture of how ridiculous he looked. Because I needed to test this abscess, the initial incision and drainage was performed by a veterinarian, who then sent it to university for culture. For that reason, I do not have any initial video footage from the veterinarian's office. Instead, I can show you flushing an abscess, intramuscular injections, and other medications of use. First up is intramuscular injection. I'm giving it a good shake. I also took it out of the fridge for a few minutes to warm it to room temperature. I'm pushing up on the plunger to remove any air bubbles. I wasn't sold the entire bottle, so I can't show you drawing it up from the bottle. But I do have 10 doses of preloaded syringes based on Mo's weight. You can do an IM injection in the neck or the butt or rump of the animal. I'm palpating or feeling through the wool, being careful to not inject near the spinal cord or vertebrae, and using the shoulder as an imaginary line. Once in the muscle, I make sure to aspirate or pull back on the syringe. This is to make sure that I am not located in a blood vessel. If you were to see blood in the syringe, you would need to pull out and reinsert in a different location. I like to inject slowly to reduce the discomfort. This can be difficult with a squirmy animal. It is very helpful to have someone help hold the animal still while you are doing this. Never give more than 10 milliliters in one injection site. Recap your needle. Next, I'm drawing up 12 milliliters of chlorhexidine, which is just an antibacterial rinse, to flush out the abscess. I will be flushing the abscess multiple times so you can see the progression of the healing. There are multiple fistulas or drainage holes to choose from. As you can see, it kind of goes in one and out the other. So now I have what I got from the vet is some gauze soaked with chlorhexidine. So we're gonna, after flushing, I'm also gonna wipe him. He gets 1.5 tablets of meloxicam for anti-inflammatory. So I'm just sneaking the tablets into the grain. Rather than throwing it down his mouth, I just sneak it into the grain. He'll gobble this grain right up. I'm also going to be spraying him at the end with this screwworm spray. This stuff is an absolute must if you have farm animals. It helps keep the flies off, and the flies get killed when they come in contact with this. It's not for large wounds, but you can put it on small wounds. We noticed that when I didn't use this, the flies were all over his abscess, all over the pus. And obviously that's quite dangerous. We don't want maggots to get laid into the wound. And we also don't want to have the flies spreading this bacteria around our environment either. So I highly recommend this. The only thing I don't like is it's blue in color, so it stains the area blue, but it's just temporary. So this is an absolute must. So first I'm going to wipe the abscess. Everything's blue in color. The chlorhexidine is blue, the screwworm spray is blue. I'm surprised that there's still pus. Yeah, so what we can do is go ahead and put the grain down that bowl, because he'll go ahead and eat that treat very happily. So that kind of distracts him. Well, then I can wipe this better because he's busy eating. So the area is pretty clean. It's tricky with these wool sheep because their faces are woolly. A Shetland would have a cleaner face and be a lot easier. You can see that the vet went ahead and shaved the skin for us, which was great when they did their initial incision and drainage. But I'm just scrubbing them clean. That's about as clean as I'm going to get. It's been wiped, it's been flushed. Now I'm going to spray. He doesn't really like the spray, let's be honest here, but here's how to safely remove your gloves. As a farmer, most things don't faze me, such as manure and earwax, but when it comes to blood and pus, I will protect myself. One thing I want to mention is that antibiotics are no longer available over the counter, and I live in Minnesota, USA. Leave a comment if you know in your area if it is allowed or not. This has been a recent change within the last few years. So if I go to my local farm store, I can no longer buy a bottle of antibiotics. Now I kind of have mixed feelings about this. On the one hand, it forces you to use a veterinarian. It's certainly better to culture the pathogen that you're treating so you can select the proper antibiotic to treat it. And it's going to lessen, antibiotic resistance and misuse. On the other hand, because of that, it's going to be very costly to work with a veterinarian to get the antibiotics that you need, not having it over the counter. So my concern is that people will choose to just cull their animals instead of spending the money on them. Next, I'm giving an intramuscular injection in the rump. I apologize for the poor lighting, as I am doing this before sunrise and after sunset. Personally, I find it easier to give injections in the rump versus the neck. If, however, you are going to use your animal for meat, you will only give it in the neck. The reason is, it can create a lesion in the meat. For me, as a vegan, this really doesn't apply. However, I do make sure to alternate the sites, so I did give some in the neck and some in the rump, as I had a total of 10 injections to give. You can see here that I'm getting quite a bit of purulent exudate or pus as I'm palpating or pushing on the abscess. This is before I've even flushed it. I am continuing to wipe and palpate the area to remove as much pus as I can before I do the flushing. I'm taking my time. As you can see, I want to be gentle with the animal, but I also need to get the job done. So the initial incision that was made by the veterinarian had healed quite rapidly. These other holes or fistulas were created by his own body. I believe at one time there were about 5 of them. So essentially, I'm selecting whichever hole is the easiest for me to get the syringe into. As you can see, as I'm squeezing the chlorhexidine into one hole, it's exiting out in a stream in a different hole. I highly recommend a helper to help hold the animal still while you're doing this. Now that I've flushed it, I'm giving a final wipe for the night. By the next day, the holes were starting to scab or crust over, which was making it difficult to insert the syringe. So I learned that it was best to use the wipe and wipe away the crusty material first. As I start to flush, you can see that there is some pus on the lower right-hand side. So I wasn't ready to quit doing this treatment quite yet. Also, there was still some swelling. If you find that you need to give injections to your sheep or goats, I have a few additional tips. For intramuscular injections, I usually use a 16 or 18 gauge needle with about a 1-inch length. For a subcutaneous injection, which is just below the skin, I will use a 20 to 22 gauge with a 1/2-inch length. The higher the number of the gauge equals a smaller diameter needle, or the lower the number equals a bigger diameter of the needle. Antibiotics are pretty thick or viscous, and so they can easily push through a 16 or 18 gauge needle, but it would be very difficult to push it through a 22 gauge needle. Now we're looking at a future day. Overall, this took a little over 2 weeks to complete the healing process. It did get rather tedious. In this example, it was slightly harder to push the fluid through, which was finally a good sign that it was starting to heal. You can see that I'm getting a little bit of resistance, and I'm having somewhat difficulty pushing it through. All of the drainage holes were starting to heal up finally, but I was still disappointed to see some pus, as you can see on the right-hand side. So I wasn't ready to quit just yet. You can see some wrinkling or shrinkage of the tissue beginning here. Now we're finally to the final rinse. You can see there is quite a lot of resistance here. I'm actually pushing very hard on the plunger to get it to go through. While the abscess was initially very fluctuant or squishy, it is now quite shriveled up and dried up. It appears quite wrinkly, and there is some scar tissue as well. I'm not sure how much of his wool will grow back. I suspect that areas where the scar tissue is, it may not grow the wool back again. Time will tell. The shriveled up tissue reminds me of the oral hematomas that this breed frequently gets. I'll be sure to do a video on hematomas as well. All of the at-home treatment is now complete, and Mo is looking so much better. He was a very patient sheep, and the bowls of grain certainly didn't hurt either. We work hard to take care of our animals. Let's stop for a couple of minutes and enjoy them grazing in my apple orchard. Currently, they are enjoying the Paula Red and Liberty apples. Thanks for watching. I hope that you learned something and you now feel more confident to give medical care to your sheep or goat. If you found this interesting or even entertaining, please consider subscribing. If you need any of these products, check out the video description.